Syngo CT bone reading. Fast rib and spine assessment in multiple trauma cases. In trauma cases with suspected injuries to the thorax, Syngo CT bone reading helps you save precious time for a thorough diagnosis of the ribs and spine. Due to the automatic pre-processing, the case is ready to review when opened. The application has identified and labeled the ribs and displays the entire rib cage rolled on a 2D planar reformat. In addition, the vertebral bodies are labeled and the spine is presented in a stretched view for a straightforward overview of the anatomy. The dual monitor capability of Syngo VIA provides you with a comprehensive and simultaneous overview of both the ribs and the spine. Let's focus on the ribs first. You can easily toggle between the long and short axis view of all ribs. The planar display of the rib cage facilitates the detection of lesions right away. As you click on a fracture, the system centers the axial, sagittal, and coronal view around the point of interest. For a conventional assessment, the system always allows you to scroll through the axial slices as well. As you assign a marker to the fracture, the corresponding information is automatically stored in the Findings Navigator for your final report. Apparently, the patient suffered multiple rib fractures. The Lesion Auto Zoom lets you focus exactly on the anatomy in question. In addition to simply scrolling through the axial slices, you may navigate along the ribs, as the system has calculated a center line for each rib. As you move along the rib, the axial, sagittal, and coronal views are updated in real time. Thus, the detection of several fractures of the same rib is facilitated. Let's move over to the second part of the screen. Due to the stretched view of the spine, the fracture of vertebral body T8 can be recognized right away. Evidently, the spinal cord is affected as well. Orthogonal to the stretched view, the system provides you with cross-sections. As you scroll through them, the position along the spine is also updated in real time. Again, a review marker may be set to bring attention to this injury in your final report. Syngo CT bone reading for increased speed in bone assessment.